you very much, Professor Dai, for the very informative talk on mCRPC and a setting in China. So I would like to ask you a few questions about this topic. So thank you very much.
Thank you.
I think the epidemiology of a presentation of prostate cancer is a bit different in Asia and in China. The first question is, what is the proportion of patients presenting with metastasis upon new diagnosis of prostate cancer in China or in Shanghai region?
Okay, as you know, China is a developing country. The area is not very balanced in China. As far as Shanghai is concerned, we still have about 30 to 40% of patients with newly diagnosed of prostate cancer have metastatic disease. For other area or for other rural areas, there may be more than 50% or even to 60% of patients with newly diagnosed metastatic prostate cancer. Very late stage at the diagnosis.
Thank you. I see. So there is, all metastatic prostate cancers will eventually progress to CRPC status. So which means the burden of the disease of metastatic cancer or metastatic CRPC in China is actually huge.
Yes.
Compared with in North America and in Europe. And definitely, I think the topic of mCRPC is even more relevant in Asia and in China. You talked about the abiraterone, enzalutamide, and docetaxel is more commonly used in China for mCRPC. Which one is most commonly used in China, and what is the reason?
Okay, as you know, the docetaxel is first approved drug for the treatment of mCRPC. Several years ago, it is the most widely used drug for the treatment of mCRPC. Recently, we have abiraterone and enzalutamide available in China. Recently, more and more patients with newly diagnosed mCRPC was treated with abiraterone, especially with abiraterone and enzalutamide. But it is more common with abiraterone because in China we have national-made drug, China-made drug abiraterone available. But the enzalutamide we only have which is made in America. The price, as I mentioned previously, the money problem is a big problem for the patients. So currently, docetaxel and abiraterone, Chinese-made abiraterone is the most widely used drug.
I see. So you mentioned about the next generation sequencing test is widely applied in China, and I heard it is actually free for the patients. In China, is that true?
Oh no, it's not. It's not free. Several years ago, many next NGS was tested by companies. Recently, especially since the last year, many hospitals they can do their own gene test. So currently in our center, most of our samples was sent to our Department of Pathology, and our pathologists will help us to do the NGS test and with high quality. As you know, money is not is also a problem, but recently government can cover some money. So more and more patients underwent NGS test after their disease progressed to mCRPC.
Right, I see. So what is the for usual patients for mCRPC that is resistant to first-line, treatments like abiraterone or docetaxel, and if the patient is considering olaparib, for example, what is the cost of testing, for example, the BRCA status or doing the sequencing test? How much do the patients need to pay?
I think for the patients who only want to do the DDR gene, DNA damage repair gene, it will cost about 6,000 yuan in China. If the patients, if the patients want to test both DDR gene and other important genes about concerning about the treatment effects, other tumor drive gene, I think it will cost about 15,000 yuan, much higher.
I see, 15,000, yes. But I think that is still considerably cheaper than that in other places. Yes. Even just for the BRCA is about $1,000 US. If you're talking about 6,000 yen, so I think it's still at a pretty low price. It's not very cheap, but it's still, yeah. So so thank you very much, Professor Dai. You have given us a very nice overview of the status of mCRPC in China, and we really appreciate you accepting our invitation. And I definitely, I hope we would see each other soon in the meetings again.
Thank you, Peter. Thank you very much.
Thank you very much, Professor Dai. Thank you.